Then a physician also gets an admin console where he can follow your progress. And we integrate all the health data with the EMR and EHR of the hospital so that there's better connectivity. And we track every activity of our users as well as the physicians. Mandated by Affordable Care Act to form and function to bring better care to the patients. And so what we did was we included a lot of Indian food, and we built a recipe builder so that you can count carbs in the food you eat at home, because we Indians cook. Also Indian food, that's very hard to count carbs. So we had our nutritionists curate every naan and roti, and we counted carbs for everything. The sambar you make at home, how much can you eat? This is very cultural.
Homework? Maybe. The fact is, there is homework. There is an important event coming up. It is on a website. There's an email from the teacher. There is too much information coming from the schools to the parents. With these devices, we connect with our family and friends with these devices, but schools are still not on these devices when it comes to connecting to parents. We are here to make it super easy for teachers and schools to send a message to parents, to send an important event to parents, and parents get a very organized, personalized view of what's going on at the school for their kids. A lot of parents have multiple kids, so the platform is built to show relevant information for kids, and it is mobile first.
And how many of you have ever had to wait more than 10 minutes? You really shouldn't have to, and that's most of all the people that put up their hands the first time were the same ones that put up their hands the second time. And that's really a problem. When in the age of Uber, Instacart, I'm sure most of you have used Uber, right? Put up your hands if you have. So you see, most of us have used Uber. We're in the age of instant economy, on-demand economy, or actually use a website like that. There's also instant gratification. Did you know 88% of Americans want some service, whatever they want, and they want it now? Not when you think you can get it to them. I want it, I've ordered it, I want it now. So is it 590 properties? It'll cost them about $18 million a year in wasted time. I call it wasted because really, they should be doing something else. When someone asks for something, you deliver it to them, and you move on. You give the guest a great experience, and you get going.
You have on-demand data consumption and data input, and that solution just did not exist. The market is chaos because they talk about interoperability, for example, but all they're delivering me is a little file that I have to sit on some computer, which doesn't allow me to access it when I want to, where I want to, how I want to. And so we built not an EMR, but we built what we call an ecosystem. We started the entire company thinking about the central core problem, which is really communication. So we built an ecosystem, not just a simple app that does one thing, like for example, obesity or smoking or diabetes. It's just an ecosystem that allows the entire healthcare team to work together. Obesity is at the very front end. It's about user experience. This was built in the field with physicians, with staff members, with secretaries, with the physical therapists, everybody collaborating to say, what can we do to make our lives better ourselves?
And so that person's ideas tend to clump with certain themes. So we really boil down to 100. Or how do you get
so we're not actually doing any contests. So 99 Designs, the way it's set up, incentivizes people to